a silent struggle, detecting the often overlooked signs of opioid addiction. Opioid addiction is a rapidly growing crisis that affects millions of people worldwide. Identifying the signs of opioid addiction can be challenging, as they are often subtle and easily overlooked. This video sheds light on opioid addiction, whether it's Vicodin, fentanyl, Lortab, oxycodone, or Oxycontin. Let's start by looking at the physical signs that may indicate opioid addiction. These signs can be quite apparent if you know what to look for. One of the most noticeable signs is a change in physical appearance. It could include weight loss, poor hygiene, or appearing unkempt. Opioids can cause the pupils to constrict, often referred to as pinpoint pupils. Keep an eye out for this telltale sign. Excessive tiredness or drowsiness could result from the sedative effects of opioids. If someone you know nods off constantly, it might be a cause for concern. Opioid abuse can lead to slurred speech and difficulty with motor skills. Watch out for any noticeable changes in their speech or coordination. Opioids affect the digestive system, causing problems like constipation. If someone is experiencing persistent gastrointestinal issues, it could be a sign of opioid addiction. Let's dive into the behavioral indicators that often accompany opioid addiction. These signs can provide valuable insights into someone's struggle with opioids. People with opioid addiction tend to isolate themselves from friends and family as their focus shifts to obtaining and using drugs. Unpredictable changes in mood, including irritability, anxiety, or depression, can be attributed to opioid addiction. Addiction can lead to financial troubles as individuals spend more money on obtaining opioids and neglect their other responsibilities. If someone is visiting multiple doctors or pharmacies to get prescriptions for opioids, it's a red flag. Addiction can cause individuals to neglect their personal and professional obligations, such as work, school, or family commitments. Beyond the physical and behavioral signs, we also need to consider the psychological indicators of opioid addiction. These signs reveal the deeper emotional and mental challenges those grappling with addiction face. Strong desires or cravings for opioids are common signs of addiction. These cravings can be a driving force behind continued drug use. Over time, individuals may develop a physical dependence on opioids, experiencing withdrawal symptoms when attempting to quit or reduce usage. As someone continues to use opioids, their body may develop a tolerance, requiring higher doses to achieve the same effects. One of the most significant indicators of addiction is the inability to stop using opioids, even when faced with severe consequences. Now that we better understand the signs, let's talk about how we can support someone struggling with opioid addiction. Start by educating yourself about opioid addiction and treatment options. It will help you provide accurate information and guidance to your loved one. Offer support without judgment. Listen empathetically and express genuine concern for their well-being. Encourage professional help. Urge them to seek professional help from a Suboxone doctor or visit a Suboxone clinic specializing in treating opioid addiction. Remember, recovery is a long-term process. Be patient, understanding, and offer ongoing support as they navigate their journey to recovery. It's time to make a difference. If you suspect someone close to you may be struggling with opioids, don't hesitate to visit SuboxoneDoctor.com. Your support can make all the difference in helping them recover and regain control over their lives.